Hi guys, I'm Noreen here at AesthetiCare, and I'm going to do a demonstration on Botox Cosmetic. Botox is a neuromodulator that relaxes fine lines and wrinkles. So we have this beautiful model here named Brooke Nelson. She is broker of KCRE, which is a real estate company, and they also have an interior design department as well. And so she is our beautiful model today. She is wanting to soften some of these lines here. So with Botox, we've got some different areas in the face that we can treat. So Brooke, go ahead and raise your eyebrows for me. So we're going to treat these lines here because nobody needs those lines up there on the forehead. We're going to treat these. Do a little frown for me. So she's squinting in the sun or she's mad at her kids, she will soften those lines here. The other thing we're going to do is we're going to soften around her eyes. So the crow's feet are one of those areas, the more we smile, the more dynamic lines we get there. So we want to treat them before they get really bad. Once they get bad, they become an ingrained line in the skin and they're much harder to treat. The other thing that we're going to treat on Brooke, she is always happy. So sometimes she scrunches her nose. Scrunch your little nose here. And so nobody needs those lines either.
Yeah.
These are called bunny lines. And so we're going to treat those. So these are the things that I'm going to kind of show you and walk you through. So if you've never had Botox, you know what to expect. Very quick procedure, couple little pokes, not painful, and it produces great results. So let's get started. Brooke, do you have any questions?
No, how long does this last typically?
So Botox typically lasts about 3 to 4 months. Now it varies on individuals. Some people get more longevity than others, but all the clinical data is longevity of 3 to 4 months. Now it won't kick in today, so you won't notice any softening of the lines today. Over the next about 5 to 7 days, you're going to notice that when you go to raise your eyebrows, you don't see all those little fine horizontal lines up there, or when you're frowning, you don't, or yelling at your kids, you don't see all those lines in the middle. It can take up to 2 weeks. So I typically like to see people back in 2 weeks just to make sure everything's perfect. What other questions do you have?
Oh, nothing really. I'm excited.
Okay, let's get started. So I'm just going to cleanse her skin. I'm going to let you lean back here, Brooke. I'm going to use a little bit of alcohol just to make sure the area is nice and clean. So with Botox, I'm using the tiniest little needle, a little insulin syringe. So the poke is very, very minimal. Some of the things that you could do if you have a low pain tolerance is use ice before the procedure. Now Brooke's got a pretty high pain tolerance. She just says go for it. So
go for it.
So I'm going to kind of walk you through the muscles that I'm going to be treating. First, I'm going to start with this region here called the glabella, and it's a series of 3 different muscles. So you've got your corrugators and your procerus. So I'm going to relax these strong brow depressors, and that's going to give her a nice big eyebrow lift. Now she's already got pretty lifted brows. Some of my clients though have heavier lids or low set brows, so it really opens up the eyes and makes them look more refreshed and more awake. So I'm gonna have you turn this way. So you're gonna feel a little tiny poke right here in the middle, my dear. And then do your little frowny like you're mad and relax. That's not too painful, is it?
Oh no, not at all.
Now, some people, when they get Botox, they get a little bit of a mild headache. So if you get a headache today, Brooke, you can just use some ibuprofen, Tylenol to treat that.
Okay.
If you don't need to. Do your little frowny again, dear, and do that one more time. And relax. So I have her contract to make sure I'm getting the full muscle length so that she gets relaxation through the medial and the lateral portion of that muscle. All right, my dear. I'm going to have you turn back this way. So now we're going to hit the crow's feet. So this is a circular muscle called the orbicularis oculi that runs around the eye. And it causes that forceful contraction or sphincter. So when you smile big and scrunch in here, you get these little dynamic lines. So when I relax those, when she will smile, you won't see all these little fine lines creeping in. So this is a great injection for people that take selfies a lot or like to post their pictures to Facebook. So this looks really smooth all the way around. All right, my dear, cheesy smile. And this one's a little pinch right here. A little pinch. And then I'm going to give her a little bit at the very top to give her a little bit of a lateral lift to open up that eye. And it'll kind of give her just kind of that little cat eye out here. All right, my dear, I'm going to turn you this way.
Okay.
So what would you rate your pain on a scale of 0 to 10?
Like right now, 0.5, if that.
So really not too bad. And the procedure is so quick.
Yeah, Yeah.
All right, my dear, little tiny pinch. I always feel like this one right down here is probably the one that's the most painful. And also, I'm looking for the blood vessels. So if I inject into one of those vessels, she will have a nice big bruise. She will not be happy. So typically with Botox or Dysport, you don't really have much bruising. Every once in a while, you might get a little polka dot bruise. But you can see these little raised portions where I put the Botox in. Those will go down in about the next 5 minutes. Some people that are really thin, you'll see kind of where that fluid is a little bit longer. But for the most part, about 5 minutes, they'll be gone. So now I'm going to hit the frontalis. So it's the elevator muscle of the forehead. So it's what helps you raise your brows. So we are going to relax that. So every time she raises her brows, raise for us again. You don't see these little fine lines. Now you want to do a small enough amount that she's not going to get a heavy brow. So people always ask, well, am I going to get a droopy brow? That rarely ever happens anymore. Now, when Botox first came out, we would do the same dosing on every single patient. That was way before my time. So that I say we, not really me, the people that started it. Now we really look for the strength that they're showing, where the muscle contraction is. And so we dose per what her strength of her muscle is. So that's why I do less is more in the forehead, because you never ever want to have this heavy brow. And when she comes back in 2 weeks, if I need to add a unit or two, no big deal. Now, if I added too much at the beginning, she got that heavy lid, there's really not a lot you can do. So less is more always in the forehead. All right, my dear, go ahead, lean back and raise your little brow for me and relax. And she pulls all the way across. Some people pull only kind of in that central portion. Since she pulls all the way across, turn this way, dear, and raise for me again, and relax. Then I'm going to treat that whole area. Raise one more time, and relax. All right, I'm going to have you turn back forward, my dear.
Okay.
And go ahead and lean back here. So the last thing we're going to do is hit her little bunny lines. So this is a compensation muscle that when you can't frown from having your frown lines relaxed, you'll start to scrunch. And so it's kind of one of those things that people, once they get Botox often, that they'll start to get these little bunny lines. So we're going to treat those. All right, my dear. Scrunch your little nose for me and relax. So a little tiny pinch. I'm going to turn you this way and scrunch for me again and relax. All right. And then you can turn back forward. So as you can see, she really doesn't have any indication that she had Botox. So quite often people ask, you know, do I need to take the whole day off work or what to expect? So a lot of people come in on their lunch break or on their way home from work, get a little bit of Botox and go on with their day. The only restrictions that we ask is that you don't exercise right after you get Botox. We want the Botox to stay in the muscle that we put it in. So heavy exercising could move it to a different muscle. And then no deep pressure, getting massage or facial right after. The following day, there's 0 restrictions.
Okay, so I've heard about Brilliant Distinctions. What is that?
So good question. Brilliant Distinctions is a rewards program through the manufacturer of Botox. And so every time you come in for a treatment, we put points in your account. You redeem those points for dollars off your treatment. And we do that right in-house. So if you have a $20 coupon, we take that off the total of your bill at the very end of your treatment, and you get those savings basically the same day.
Great.
So if you have any questions about the procedure we did today or anything else related to products or procedures that we do here at AesthetiCare, don't hesitate to give us a call. We'd love to answer your questions. Thanks for watching.